एक काम करो। Yes, good morning. Good afternoon, one and all. I, Dr. Swapnil Gawande, on behalf of IIAS and Approachin Ayurved Gurukul, welcome you. Yes, Dr. Sandeep, because of some technical glitch, we got late. Sorry for inconvenience, as the time was already 3:30 because of the OPD and some internet glitch. I got late. I would like to request you all that please communicate me with chat only until I ask you to raise your hand. So, first of all, am I audible? Am I audible? Somebody please put into the chat box. Okay, thank you, Dr. Meenakshi. Thank you, Dr. Narendra, Dr. Arsha. Okay, friends. I hope that most of you have gone through the last lecture of this ortho series. In today's lecture, we are going to discuss a unique case of my practice. As in the message you may heard or you may read about the case of a 25-year-old female married patient with a sudden loss of power in her upper limbs. Uh, Without wasting time, let's directly go to the presentation. In today's lecture, we are just going to discuss this atypical case. And after that, we will have a short question answer session. And there is something very unique for you people. So stay till end. Okay. Just a minute. So this is how, sir. सर हे बरोबर चालू आहे का फक्त बघा प्रॉब्लेम असला तर मला कॉल करा. Okay, friends. So the case is of an acute neurodeficient. This is a recent case. Actually, the case is already going on, but I feel that these kind of cases should be bring to the knowledge of our peoples, our fellow practitioners, Ayurveda practitioners, so that they can understand the power of Ayurveda diagnosis and Ayurveda point of view. This case is not a true case of orthopedic, or it is if the because this case first gone to the general physician, where general physician referred the patient to the neurophysician, then the neurophysician referred the patient to the neurophysiologist, and neurophysiologist again referred to the patient to the neurophysician. And after wandering from here and there to there and there, patient came to us. Okay, so let's start the case. So the patient presentation was a 25-year-old married lady came with a symptom of sudden loss of power in both the forearms. It is not actually the forearms, it is the forearms, that is of the upper limbs. She was unable to hold the objects in both of her hand. There are sorry because I have made this PPT in very hurry, so there may be some spelling mistake. So please bear with me. Both of her hand was unable to hold the spoon or object, or she was unable to hold the pen, and she was unable to write it also. So basically, the fine movements like holding a spoon or opening a cork of the bottle or writing, she was unable. She was having a absolute power loss. So if you calculate it on the scale of 5, it was near about 1 to 2 to resistance only. So she can't hold or grab anything. She was unable to hold the glass to drink the water also. Then symptoms started suddenly with no specific history. The only history was having a mild diarrhea approximately 10 to 12 days back. And after that, and the diarrhea was also not so much severe. She got the loose motions and 1 or 2 episodes of vomiting, and then she got relief automatically. Also, she was having the stiffness in back and shoulder muscles. She was telling that she can't sit for a long because after sitting for 5 to 10 minutes, her shoulders and back started spasm. Also, generalized edema and the generalized weakness was present. The patient was also complaining about giddiness on standing, on rising up, on walking. Okay, we are going to make this presentation a little bit interactive. So this is the presentation of the patient when it came to our OPD. It is not an old case, it is just a 15 days back case. Basically, I got late today to join the class because of her only, because she just visited. Okay, so what was the Ayurved point of view? Symptoms were there. So the Urdhva Hastagat Daurbalya was there, Chimchimayan, the numbness was there. Also, there was Anga Gaurav, that is generalized swelling. The Sammal Pravrutti, she told that. Also, Bahu Mutra Pravrutti was there. So, polyuria was there. Sticky stool was present. Again, the nadi when I gone through was a Vat Pitta nadi, and also Sashul and Manda Chesta. Whenever she is moving, whenever she is walking, sitting, or doing any of the activities, she was having a pain here and there. The pain was not stable. Okay, so for a few minutes, I will stop sharing. Okay, now the question is for you. As we are already late, I am giving you the 4 minutes. Please tell me your opinion about this case. What do you think? Or what should we do? Though the slide were not visible, I think that I was audible. Saket Das, good. GB syndrome. Again, come fast. No fever history, Dr. Sandeep. You can raise hand or you can put the message. Both the way you can do. Cervical spondylitis. Good, Dr. Kalpa Ayurved. Troto-orojanya Vata Prakop. Okay, good guess. Cervical rib compression. Okay. Cervical radiculopathy. Okay, that is one and the same thing. Cervical spondylitis and cervical radiculopathy. That is a symptom. I am asking about the diagnosis. One more minute, please. If say anybody tells, anybody want to speak, he or she can raise the hand, and I will unmute him. There are 80 peoples here, and only 4 to 5 responses. Just keep your answer in short, doctor, whoever is raising the hand. Just a minute. Who has raised the hand, please? I think she had lowered the hand. Cervical Pakshaghat Chikitsa should be the principal line of treatment for this. Saket Das, I have not asked about the treatment. I am just asking about the diagnosis. What is the diagnosis? What Chikitsa we will discuss later. Wrist joint nerve compression. Anjali Patil. I don't know what you guess it, but it's okay. Oh, Bahuk. Okay. Cervical spondylitis. Yes, okay. Okay, let's move again to the presentation. Okay, so this was a Ayurved point of view. Lakshana was there that Urdhva Hastagat Daurbalya Chimchimayan Angagaurav Sammal Pravrutti Nadi Vat Pittas and Sashul Manda Chesta were the few of the symptoms and few of the findings were there. Now, as some of the one of the doctor has correctly said that it is a Guillain-Barré syndrome because it is a the presentation was more or less like that, and most of you have said about cervical spondylosis with the radiculopathy. Now, just see the differential diagnosis between these two things that most symptoms increase gradually in the cervical spondylosis. The most important thing in this case, I have told that there was a sudden loss of power. Okay, so there was no gradual increase in the symptom because the patient was just 25-year-old female. Now, when speaking about the GB syndrome, generally symptoms start as a tingling and weakness in the feet and progresses upward to the upper limbs. So, generally, the GB syndrome is a progressive disease which starts from the feet and goes up to upper limbs. But yes, there are the rare cases or there are some of the cases in GB syndrome which starts from the upper limbs. So, we cannot 100% rule out the GB syndrome. Okay, then in cervical spondylosis, fine movements generally involve in very advanced cases. Okay, so uh, there is also we can rule out this thing because the fine movements have suddenly affected. Then in GB syndrome, rapidly progressive disease, history of fever or viral disease, as somebody correctly asked about the history of fevers, but there was no history of fever in this particular case. The history was of only of a diarrhea. Okay. Then about cervical spondylitis or cervical radiculopathy, slowly progressing disease most commonly found into the 40 plus individuals. Though today in today's lifestyle, you may find the patient with cervical spondylosis or cervical degeneration who are younger also or younger or 25 in 20s in 30s also. So it is not an obvious part to rule out, but particularly in this case, we can say that because the progress, the manifestation of the disease was the sudden case. It was not uh, gradually progressed. Okay, so now just see that what is these two things came to everybody's mind. The first impression of the general physician or the neurophysician were the GB syndrome itself, and what let's see what they have done. So for basic investigation, they have done the hemogram or the CBC. So in this particular CBC, there are no abnormalities. Obvious abnormalities are there. The platelet count is okay. The WBC, which are sometimes you can find a raise in GB syndrome, are also within limit. Then there was no obvious deformity in the complete blood count. Also, you can see the ESR. Here the ESR is also 28. So in females, ESR 28 or 30 is sometimes normal. In menstrual cycle, also it can raise up to this level. Okay, so this was the ECG, which was sorry, CBC, which was nearly within limit. Now this was the test that the calcium deficiency or the calcium test. It was optimum. At least you may have seen a very less females with kind of this kind of reports that serum calcium was 8.8. That is, it was about significantly okay or significantly in within limit. Then the electrolytes which get disturbed in GB syndrome were absolutely okay. The potassium is 4.5, the sodium is 140. Also, the CKP, which shows the brain stroke or convulsion, delirium, like things, or the neurological deficits or myocarditis like deficits are seen. It is also negative. It is just 117. It should so therefore CPQ also was normal. And the most important factor is CRP, that shows the severity of the disease. The CRP is also only one. So these basic reports which shows the primary signs of the GB syndrome were normal. Then here we find some of the deranged reports. The vitamin B12 level is just 153. It was below the required mean reference rate, and also vitamin D3 is also in a deficient level, that is 5.56 or 5.66 only. So here we find, according to Ayurveda, we can say that there is a Raktakshay and there is a Dhatukshay. But again, the question rises that this deranged level of the B12 and the D3 can't happen in a sudden, because the presentation of the patient was that I was slept yesterday night and today when I woke up, I found that my hands are not working properly. So, though there is a vitamin B12 deficiency, there is a D3 deficiency, but in such cases also there is a long-standing history of pain, myalgia, swelling are there present. Okay, so this basic up till now we can say that this patient was, or the case is of the degenerative arthritis. But again, the question arises that why the symptoms suddenly. Okay, then this was the MRI spinogram. In this particular MRI spinogram, the conclusion part you can read. The MRI study reveals changes of spondylosis, age-related degenerative spondyloarthropathy. Now the question is that the age-related, the patient here you can see the age is just 25 years female. So the 25 years is not the age of degeneration, but still the patient, as we have seen that there is a D3 deficiency, B12 deficiency, so still the patient is having the degeneration. But this degeneration is not happen in a day or in a night. So it is the degeneration at this level has gone gradually, but the patient was not having the symptoms. So these are some findings that posterior disc osteophyte complex partially efficiating the anterior subarachnoid space are seen C3, C4 up to C7 levels. Also lumbar levels from L4 to S1, that is L4, L5, L5, S1 level, diffuse posterior disc bulges abducting the thecal sac transversing nerve root. It is encroaching upon the bilateral neural phenomena. But this is in the lumbar. But she was not having any issue into the lower limbs. Okay. In cervical complex, there is no obvious compression of the nerve root. Only there is a degenerative changes and osteophytes are there. Uh, okay. So again, I will stop sharing for the same. I have now presented to you the findings. Now, now can we acute demyelination of neuron? Yes, sir. Good guess, Dr. Kotule. What is the reason? So again, what do you think now? Any guesses or any further investigation we should do? Please be fast. We have 3 minutes only. Any guesses? There are nearly 90 people's EMG study should be done. Okay, good. And what do you think about the neuron test? I mean to say that you want to say the nerve conduction study. Yeah, Dr. M. Lata. Yes, good. MRI, you already said, madam. We have already showed you the report of MRI. MRI brain, you can say. KFT and BP should be done. Okay. But what is the logic behind doing the KFT? Okay, BP, I will tell you the vitals are stable. Dr. Sangeeta madam. Vitals are stable, but what is the logic behind doing the KFT? Lipid profile. What logic you put behind doing the lipid profile? Yes, Dr. Chanchal. Yes, Dr. Chanchal. Please speak up fast. Audible to you? Are you there? Generalized edema. Okay, for generalized edema. Yeah, but the symptoms, okay, I got it. Got your point for the generalized edema. But the thing is that CBC, madam, we have already done CBC. I have presented the CBC reports. I have shown the CBC reports. Dr. Sangeet, the good logic behind doing the KFT for generalized edema. Yes, Dr. Chanchal, if you are there, please speak fast. Hello, Dr. Chanchal, if you are there, please speak fast. CBC we have done. So in KFT, actually, the electrolyte we have done. So if there was anything in the KFT, it will reflected into the uh, electrolyte and also into the CRP. Dr. Meenakshi, usually this condition is uh, malabsorption of nutrient from gut, but the thing is that if there is a malabsorption, there will be the deficiency, there will be the nutrition. You can say this for the vitamin D3 deficiency or vitamin B12 deficiency. But what about the acute loss of power in the arms? Some work disorder may be definitely. Dr. Sangeeta Madam, we are definitely discussing about the some work disorder, and I am going to tell you the diagnosis also. I am just doing the brainstorming. बिना वात नस्ती रुजा, कफम पंगु पित्तम पंगु पंगवे मन लातवा, हम बचपन से सुनते आए हैं. So definitely this is a Vat Vyadi. This was a Sarvanga Vat Vyadi. This may be the Majjagat Vat. This may be the Shiragat Vat. Okay, so just move forward. I was expecting some answer, but I will show you. Worms in the gut. But madam, have you ever seen a symptom? Or Dr. Kalpa Ayurveda, I don't know, madam or sir, but is there any reference of having this kind of symptom in Krumits? You are nearly correct, Dr. Kalpa Ayurveda. You are correct. You are nearly guessing correct. But what is your logic behind saying these worms in the gut? Cyst. Where is the cyst? Okay, let's go back to the presentation. So we have seen this MRI spinogram and it was absolutely normal. The most important thing, the missing part was the history was of a diarrhea, and it may be the viral diarrhea, it may be a bacterial diarrhea. So the important thing we must do is the ASO titer. So here you can see that the rheumatoid factor was negative, the uric acid were negative, therefore it was not an RA, it was not an uric acid or gouty, but the ASO titer was positive of this patient, and this shows that the patient was being affected or been infected with some or the other kind of streptococcus infection, and as a result of that streptococcus infection, patient was having the arm vat lakshana. If we go back, to this first presentation, you can see that just view the first paragraph of loss of power, but in from the second symptom, the symptoms started with no specific history. The only history was having the mild diarrhea, approximately 10 to 12 back. Hence, I called the doctor that he was approximately correct that it may be a Krumi Samprapti, the Hetu may be a Krumi, but what then also having the stiffness in the back and shoulder, generalized edema and weakness and giddiness. These three of the last symptoms clearly shows the Amada Samprapti, though there was not a obvious fever to the patient. The patient was not having a history of fever, but still the Anga Gaurav in Ayurved point of view, hence I have explained the symptoms in both the way that there was a Daurbalya, Chinchimayan, Anga Gaurav, Sammal Pravrutti, and Sashul and Manda Chesta. The Nadi was Vata Pittas, and this, if you will see all these all collectively indicates the Amaj Samprapti, the Amaj Samprapti, and then when we go here, we find the Dhatukshay. So it is you. We can collectively see that it was a Dhatukshay along with Amaj Samprapti. So we can technically say that it was a Kshay Janya Amva. But what was the hetu for it? The hetu for it was the ASO. The ASO is done to determine whether the patient had a recent streptococcal infection with the bacterial group of group A streptococcus to help the diagnosis complications resulting from a streptococcus infection such as rheumatic fever. Though there was not a fever, but definitely there was a rheumatic or rheumatism like symptoms present in the patient. Okay, I will come back to you again. Was this report visible? Was the report visible? Dr. Snehal Kale madam, we will have the question answer session at the end. So please raise your hand sometime later. Okay, thank you. Sorry, sorry, sir. I will again show you the because okay. So here are the RA factor which is negative. Again the uric acid which is also negative, but the ASO titer of this particular patient was positive, which indicates that there was a streptococcus infection. There was a streptococcus infection, and ASO is done to do the antibodies of the streptococcus or streptopolycillin antibodies in your body which are developed to cope up with the streptococcus group A bacteria and which shows the symptoms as a rheumatic fever. Got it? In this particular case, as we have seen, look, this is ASO positive. Though they have not get that titer, but when I ask about the titer was 482. Though it is not mentioned as the pathologist, the titer was 482. Okay. So now coming back to you. So in this particular case, we can say that there was a Amaj Samprapti, the hetu for that particular, maybe the Krumi or maybe the Garavish. As Madam said that there was a malabsorption of nutrition, but I say that it is an indigestion or ingestion or intake of some of the foul food or the stale food may be there, and it causes the garvish, and this was the garvish janya amvat, and the contributing factor was the degenerative changes, the vitamin D deficiency and the B12 deficiency. So, as per this Ayurved point of view, we can say that as a amvat janya vat vikar or the क्षयात्मक amvat. Dr. Mane, we will discuss in the last. I will please have a patience. Please let me finish, and then I will allow to raise the hand. Till then, you can message your query or your into the chat box. So, how many of you agree with me? Look, friends, in this case, we have to be very vigilant. We have to depend upon Trivid Pariksha. We have to vigilant about the Dhatu Avastha. We have to be vigilant to our Pradnya, that is the instinct also. Because when the patient came to me, he came to me, he or her husband actually, he came to me with consciousness, sir, GP syndrome होगा क्या, ये होगा क्या, वो होगा क्या. So the thing was good for me that he already had visited the neurosurgeon, he already had visited the general physician, he already had the appointment with neurophysician, though he was gone today to do the nerve conduction study, but he had not got the appointment. One more thing, that there are the chances that nerve conduction study will come normal, because in one of the participant said very good demyelination. So, sir, this case was actually 15 days old case. Because of some hurry and the heavy OPD I am having since last 8-10 days, it was difficult me to put the complete line of treatment I have given to it, but I am going to share it with you. So the simple thing which I have done, acute demyelination, somebody told of the neuron, but in that particular condition the patient is progressive. The demyelination of the neuron is very progressive, very rapid. So we have to put the patient on the immunoglobulin and all that. But the patient, when came to me, already came after 5-7 days of the initiation of the symptoms, but the symptoms were stable. They were not raised or they were not decreased. After that, what we have done, we have done the basic thing. I have started with the Amruta Gugul, Purnava Mandur, and the Palsineuron. But as such, as soon as I have started with the Palsineuron, in 2 days, patient complaining about the hyperacidity, while the patient was not complaining about the hyperacidity on the day first. So it shows that the Samir Pannagras or Ekangvir Ras, the contents of the Palsineuron, are very tikshna, or which increases the pitta, and hence I started that and started the Sutshekar Rasa with the Paripatadi Kada. Also, I have done the uh, orthopedic test for the nerves, clinical test, in which what we do today, I don't have any um, particular male uh, volunteer. Otherwise, I will show the video. I can't take of the patient because the patient was very shy and was not allowing to do the videography of her examination and treatment. Hence, I am sorry, I can't share the videos of that particular patient. So in that particular test, what we do, uh, I ask the husband of the patient that to hold the hands, arms like this, and I, standing behind her, lift the lift her cranium totally. And when as soon as I lift the cranium, the powers of the her hand was slightly increased, and it indicates that definitely the loss of power was because of the compression of the nerves. This is the one thing. But why it happens acute now? Because though we can see in the MRI that there is a cervical spondylosis, there is a degeneration at multiple levels in the cervical spondylosis, but why it happens acutely? So what was the contributing factor for that was that infection 10 12 days ago above in the gut may have produced the amaj samprapti. It gives or it promotes because of that amaj samprapti, because of that particular toxins, there was inflammation. It it was like a garavish. That particular infection work as a garvish, and because of that garvish there was a swelling, there was a generalized swelling. So as a generalized swelling, generalized edema, the edema was on also on the intravertebral disc, and the intravertebral disc of the cervical spine when got inflamed, they start compressing the nerve roots, and acutely she got the loss of power. But as soon as I lift the head or the cranium of that particular patient, what happens? The pressure over the intervertebral disc get relaxed, and the nerve conduction got increased, and hence the power in her both the hello, huh? Sorry, it's busy right now. So at that point, I came to an conclusion with a confidence that this is happening only because of the compression of the nerve root, and there is not an involvement of the brain in it, or there is no demyelination. After that, as I have told you, the medicines, the final prescription was the uh, Chutshekar Ras, Amrutadi Guggul, Kaishor Guggul, and Paripatadi Kada. And also, I have given her the Eranda Sneha for the Mrudu Virechan. In the 7 days follow-up, the patient got relief up to 10 to 20%. She was now unable. On the first day, we have asked her to open the cork of the bottle. She was unable to cork. Also, her fingers and hands were like paralyzed patient. We can do this. We can straight it, but she was unable to straight that hands after 7 days. And also we have asked. I have prescribed her the Shulher lip at her back in the cervical region up to the lumbar region, from cervical to lumbar region. That is on the whole course of the spine. We have asked to apply the uh, shoth her lip, sorry, and ask her the intermittent fasting, that is Langhan. So after 7 days, when she came, she told that there was a significant improvement into the stiffness. Also, she was not unable to rise up on her own. She had to take some or the other support to get rise up from the chair. Now, when last week she came, she was unable to stand up on her own. The power was better, but still there was symptoms were there. The polyuria was decreased. The motion were good. the samata in the mala was reduced, though there was it was there, but it was reduced considerably. And today, after 15 days, when the patient came, the patient was more better. Today, we have done the marma chikitsa for that patient. We have done the marma pidan at Shipra marma, then the Indravasti marma and the Ansaphalak marma, and also to the Kakshadhara marma. And after the marma chikitsa, the power has increased around 20 to 30%, and the patient is now able to hold the pain. The patient is able to unwind or unscrew the cork of the bottle and able to fit the cork of the bottle. So this was the case. Again, we have added one Swarna Kalpa today, Ras Rajeshwar Ras, again along with the previous medication. So this was the case actually. I have to discuss. I want to discuss with you today because you can see that this is how important and how holistically we have to see to the case. Though MRI was showing the spondylosis, so but the ASO was positive, so we have to set the protocol for this kind of particular treatment. We have to decide that my specialty is to manipulate, my specialty is to correct the posture. If the patient was not having the arm work, I can definitely tell that up to now the patient's power would have been above 7 8. That is, the patient may have felt 70 to 80% better. But because of this amatva, first of all, I have to do the arm pachan. I am resisting myself for doing the Vedan karma and other modalities like osteopathy or chiropractic adjustments. Yeah, after 15 days, after reducing the swelling, after reducing the symptoms, today I have done the marma chikitsa. So this was the case for today's. Now the question answers are open for next 5 minutes. I am going to wait for your case discussion. First of all, was the case? Do you find this case an interesting one? How many of you find this case interesting? Please type Y. Or how many of you have gone through these kind of cases? Thank you, thank you, thank you, madam. Yes, now you can raise your hand. I will just request, please keep your question short so that other will get the chance. Yes, Snehal madam. Hello. Snehal madam, you are not audible. Okay. You can also ask the question in chat box if there you have an issue with raising hand. Yes, Dr. Jayant.
No, sir.
You have any question?
No, sir.
Okay. Any questions? Any inputs about this case? Okay, till then, be ready with your questions. Till then, I will going to show you something bonus for you. The Arvachin Ayurved Gurukul and IIAS, on which app you are watching or listening to this online webinar, we are coming with a master class in Ayurveda Orthopedics, the 6-month comprehensive orthopedic course for Ayurveda doctors. In this, we are going to discuss step by step the practice related to the orthopedics and the cases related to orthopedics. And briefly, I'm going to share with you the structure of the class. The structure of the class will be the master class in Ayurveda orthopedics, in which we are going to see the module by module. Around 60 to 70 lectures will be there, which are divided into the different modules. Those are in the different 11 modules. So if you can see the modules, I'm not going to read each and every part, but if you will go through the module, the first module is to introduction and general anatomy, or the saptadhatu and kala and functional anatomy of, so that we are going to integrate and compare the modern and Ayurveda diagnosis, and how we should look towards it. In the module 2, we are going to see the mechanism of the pain according to the modern science and according to the neurology, then classification of the pains and vatroga in Ayurveda and modern point of view. And the third is that the clinical diagnosis, the postural analysis, radiological analysis, and the pathological. In this case, as you have seen that how the pathological, one single pathological investigation ASO have changed the complete line of treatment or complete confidence of the mind. Okay, then we are going to see the how to set the Panchakarma protocol, regular Upakarmas, the modified Upakarmas, Agni Karma and Vedan Karma. In the Vedan Karma, we are going to see both Uttan and Gambhir. Also in Agni Karma, we are going to see the different kinds of Agni Karma modalities. Then we are also going to see the myofascial release technique like cupping, dry, wet, dynamic, then bandha and lepan, kinesiology tapping, myofascial release, these kind of supportive treatments, along with Upakarma and Panchakarma. Again, the supportive treatments like trigger point therapy, Marma Chikitsa, osteopathic articulation, and soft tissue mobilization. As I have said in this case that I have done the Marma Pidan or the Marma manipulation. Then we will go the segment wise. In from module 7 we will go segment wise, that is the cervical spine, thoracic spine, then in and the lumbar spine. The module 7 will be dedicated to the complete spinal segments. Then we will go to the pelvic girdle. In 8th schedule there will be the upper body joints like shoulder, elbow and wrist joint. In module lower body, in module 9 lower body will be there. And module 10 there will be the rare cases like rheumatism or the different kind of diseases like ankylosing spondylosis, the RA, the rheumatic, the polyarthritis, the post-viral arthralgia, and other syndromes we are going to cover. Then ankylosis we are going to cover in this module only, in which what the modern approach is there, the ankylosing spondylosis, the ankylosing of the joints. You may have encounter with the ankylosis of the knee, ankylosis of the elbow is very common. In module 11 we are going to see the special conditions. So how to diagnose? This was a rare case of special diagnosis. We are going to discuss more cases like this. And in module 12 we may have we are going to discuss about diet, nutrition, yoga for rehab. And there is also one thing, that is the muscle energy techniques that you have to prescribe the patient after treating their orthopedic conditions. So these are the complete comprehensive course for the Ayurveda doctors. So the technique we will learn for the pain management, there will be more than 15 techniques I am going to share, which I am practicing in my daily OPD with you. That is the functional anatomy, diagnosis, clinical and radiological, Marma Chikitsa, Bandha Chikitsa, Agni Karma, cupping, innovative Panchakarmas, posture correction, myofascial release, Gambhir Vedan, trigger point therapy, posture correction, osteopathic articulation of the spine, instrument assisted soft tissue mobilization, that is ISTM, muscle energy techniques, and rehab protocols. So if you have seen in the modules, we are going to discuss about the diagnosis, the modern diagnosis, the Ayurveda diagnosis. The treatment is also what, but we are going to discuss that how to diagnose into modern and into the Ayurveda point of view, and how to set a treatment protocol in each model, in each disease. So if you will go and learn all these techniques and all these modalities, then it will cost more than 2 to 3 lakh rupees. I have already spent more than 15-20 lakh rupees to take all this knowledge and all these modalities to practice. So this is me, Dr. Swapnil Gawande, founder and chief consultant at Spine and Joint Care Center at my Ayurveda Multispecialty Ayurveda Hospital. I am also honorary medical officer at Shiv Chhatrapati Kridapit Pune's Krida Prabodhini Akola. These are my all teachers, as I have said that all the knowledge I have gathered from these national, international, and super gurus. My super guru is Dr. Ramdas Awad sir. And if all these technique learned separately, approximately cost rupees 2 lakh rupees. But we are offering this at only rupees 20,000. But special discount till 1st June, as Dr. Lalit Heda sir and Manjusha Chitte madam asked me that there are lots of students who are attached with us from last many years. So we have curtailed down this test. And one more thing I am going to share with you, that the special discount till 1st June, if you register before 1st June, the fee will be 15,000 only. And if you register within 48 hours, that is before 31st of the May, you can book your seat by paying only 3,000 rupees. Rest you can pay before course for this 15,000. After the speculated time, the fees will be 20,000. And the mega bonus is that the mega bonus, the most important thing, the 2 days offline workshop we are going to hold for hands-on training worth rupees 15,000 is absolutely free with food and accommodation. We will have a, but this will be for first 50 admissions only, because as we are offering it free of cost, so we have the limitations, and the limitations we have raised up to 50 admissions. Here we will have lots of learning, lots of hands-on training, lots of enjoyment, lots of knowledge sharing sessions. We will try also to invite some of the eminent speakers for this particular 2 days offline workshop. So this was the mega bonus for all the participants joining today. For more details, kindly take the screenshot of this particular details. You can contact Dr. Manjusha, you can contact Dr. Lalit for more details. If Dr. Lalit or Dr. Manjusha is there, they can raise the hand. I will unmute and they can share more details about this. So this was all from my side, friends, today. Will I am there for next 5 minutes. Yes, sir. Pallavi Chavan, ma'am, the course will be online, but we are going having the 2 days offline course also. Can we get personal consultation about the cases? Yes, ma'am. Can I get your contact, Chanchal Karla? Okay, I am just putting my number here. But one thing is there. If I am busy with the patient, I will request you to please put your, this is my personal WhatsApp number. You can put the case and details on the WhatsApp first. So I am here. You can discuss with the case we have discussed today. Also, who have attended the last lecture of this series. The next lecture of this series, this is also we are doing the free series of lectures to enhance the knowledge. The next lecture we may have on the 7th June. 7 6th or 7th June. We will declare the date soon. Thank you, Baba, for sharing the Dr. Lalita and Manjusha Jitya madam. So no questions. You can ask the queries about today's case. If you got the query about the diagnosis, if you got the query about the Samprapti Bhanga. Also, take the opportunity because might be next time this course will not be available online. If there are no questions, Dr. Sangeeta madam, knee dislocation, what do you mean by first knee dislocation? Definitely you can understand that what you have to do and what you don't have to do. Because when the knee is dislocated, what you expect? That what is dislocated? If you are asking about patellar dislocation, the patellar dislocation can be easily achieved. Or if there is a degeneration in the patellar dislocation, you have to use the surgical way. Got it? Yeah, but if there is a subluxation or there is a rotation or there is a malformation of the knee joint, definitely we can do that. We have a complete separate course called Januveda on the knee joint pain. We have conducted it last, I think 2-3 years back. It is still available on the IIS app. You can contact Dr. Manjusha and Dr. Lalit Heda sir if you want to do more studies in the knee joint. Sir, first of all, I never, one more thing I will tell. I will not directly going to tell you the treatments because I do believe that telling a treatment is just like paralyzing you. First of all, you have asked Dr. Verma sir or madam that best treatment for spinal pain. So first of all, my question is that where is the origin of the spinal pain? What had happened there? Paraspinal muscle spasm can also give rise to the pain. So if there is a paraspinal stiffness, just Nehan Sweden can do. Sir, you are just telling me the sacral region, but what is the pathophysiology is there? Dr. Deepika Dixit, madam, I will come to you. Very good question you have asked. I will tell you. I will answer. Just so, Dr. Verma, only sacral region is the location of the pain. I am asking about the pathophysiology. Is there is a disc involvement? Is there a nerve involvement? Is there a ligamentum flavum atrophy? Is there? What is the manifestation of the pain, the location of the pain, the duration of the pain, the type of the pain? Is it a tingling? Is it a sir disc? One more thing, disc compression never give or never arises the pain. I will show you thousands of patients who are having the disc compression but they don't have any pain. So that's what I say that go to the diagnosis because I will tell you, okay, sir, do the Agni Karma there, do the Vedan Karma there, do the cervical. If it is in the sacral region. Okay, do the lumbar roll and do the manipulation. There are lots of things. I hope you are understanding my concern about the pain. First of all, in this particular today's case, I have shown you that we have ruled out one by one the diagnosis, and when we come to a conclusion that this was because of this, we have put all this into the on the paper. We put all this, that what is the reason for loss of power, what is the reason for generalized edema, what is the reason, what was the history, and then we come to the particular part. Okay, so this is a spondyloarthritis along with the Amas Samprati, that is the rheumatism, and the cause of this rheumatism may be the ASO positive, that is the streptococcal infection, which in correspondence to the Ayurveda we can say that it is a Garavisha or the Krumich wish, and because of this, we have to give the first the Dipan Pachan Chikitsa, the Am Pachan Chikitsa for the patient, and after giving the Am Pachan Chikitsa, we have done the actual Marma Chikitsa, and this all whole thing gives the result. If I would have asked the question, somebody has already told directly before diagnosing, directly come to a conclusion with the treatment that the treatment should be the Pakshagat. So, first, we are a doctor, we are not the quacks, we are not the quacks who are writing behind that हर बीमारी का 100% इलाज किया जाता है. We, if we are a doctor, we first should convince with the diagnosis. At least there are the conditions that we can't diagnose 100% correctly, but I think that we should try our best to reach to the optimal level of the diagnosis. That's why always I insist on the process. Follow the process. Results are bound to come. If you will bypass the process and focus on the result, there are chances that you are going to fail. There are more chances you are going to fail. I am not criticizing any particular thing, but I got the patient from many Ayurveda doctors. They are complaining, डॉक्टर साहब उन्होंने चटके दिए, 2 दिन अच्छा लगा लेकिन वापस वैसे ही हो गया. उन्होंने सुई चुभाई, कुछ दिन अच्छा लगा फिर वैसे ही लगा. So I am not particularly telling it to Dr. Verma. I am telling it to every participant who are there that if we are doctors, we have the responsibilities that we should go near to the diagnosis. अगर आपके पास 1 घंटा है ना एक ट्रीटमेंट करने के लिए, तो मैं बोलूंगा कि आप उसके से 50 मिनट डायग्नोसिस पे लगाइए और 10 मिनट में पेशेंट को ट्रीट कीजिए. होता है बहुत बार कि हम 10 मिनट में डायग्नोसिस करते हैं और 1 घंटा ट्रीटमेंट को लगाते हैं. देयर आर लॉट्स ऑफ केसेस आई हैव सीन इन द लास्ट लेक्चर. जो जिन लोगों ने अगर लास्ट लेक्चर देखा है तो ठीक है, जिन्होंने नहीं देखा है लास्ट लेक्चर, सो आई विल अगेन शेयर, और डॉक्टर ललित इज देयर, आई विल ask him to put the recording of both this lecture, the last lecture on the group. Go through that lecture. I have demonstrated the cases. I have shown some of the cases where you can, if you diagnose correctly, you can treat the patient into 5 minutes. But if you misdiagnose the patient, it will take a lots of time to treat, or you will keep on searching for the correct treatment. So don't take it otherwise, Dr. Verma, but this was actually for every person. As Dr. Sangeeta asked that knee location, ma'am, there are lots of joints in the knee. Here there is a patellofemoral joint, there is a patellotibial joint, there is a internal lateral femorotibial condyle joint, There is a medial femorotibial condyle joint. There are the joints of uh, joints for the ligaments, the tendons, the meniscuses. Which dislocation? First, we have to find. We have to reach, and this is what we are going to see in the master class. Also, I am not hiding anything, so I have asked. I have told that uh, if you have the queries, you can ask the queries for today's particular case. Okay. Then somebody asked about the post delivery pain. So, sir, best treatment for spinal pain can we be? Sir, pain after cesarean section is common complaint. What should be done? So, Dr. Deepika, madam, if you are there, so this answer is for you. First of all, understand that why there is a pain after cesarean. There is not only the pain after cesarean, there is a pain after any kind of delivery. It may be a normal delivery, it may be a cesarean section. So the basic reason for that is that a patient is carrying or a female or that particular mother was carrying the baby and the weight of 9-10 kgs for more than 9 months. And because of what happened, let me explain you with this particular model. So what happened? The baby is here, and because of baby weight, the pelvic region got start tilting like this, and this tilting causes the extra pressure on the quadratus lumborum muscle, the spinous erectus muscles, and all the pelvic floor muscles. And because of this particular stretch for this 8-9 months, this muscle becomes fatigue, and this in result these muscles start aching. These muscles start paining. So for that purpose, you have to first identify that the pain is arising from the muscular region or for the spinal structure. If the pain is muscular, the simple Snehan Swedan and the Matravasti. The Matravasti gives very good result. You can start with the Matravasti of Sahachar Tel. If there is no Amaj Samprapti, because most of the patient with the low back, not most of the, but at least half of the patient have the pain, and most of the time the Sutika Paricharya was not done properly, and because of that Sutika Paricharya errors, there may be a Sutika Jwar like symptoms which had got a Katishul Lakshan. So you have to understand about that Sutika Jwar or Sutika Paricharya. You have to keep in mind. Also, after all this doing, you can advise patient the muscle energy techniques, the exercises, the pelvic floor exercises, the pelvic floor strengthening exercises, the core strengthening exercises like yoga. Also, there is also one misconception into the cesarean section patient that वो इंजेक्शन दिया था ना डॉक्टर वहीं पे दर्द होता है वो इंजेक्शन दिया था वहीं पे दर्द होता है तो one of the reason is that if the piercing of that spinal needle has injured the particular disc or the not disc actually the particular structure like ligament or muscle or the nerve, it may also be the cause of pain. Yes, madam, that's what I am telling you, that the injection which was pierced, So they have the mind that I have been pierced something into the my बैक. और उसके बाद क्या है ना कि नॉर्मली नॉर्मल डिलीवरी के बाद मूवमेंट्स बहुत जल्दी होने लगता है, लेकिन सिजेरियन सेक्शन में क्या होता है ना कि फॉर द प्रोटेक्शन ऑफ द स्टिचेस और बहुत बड़ा स्कार होता है, तो उसकी वजह से क्या है ना कि बेड रेस्ट थोड़ा ज्यादा दिया जाता है पेशेंट को. सेकंड थिंग, वहां मसल स्पैजम और प्रोटेक्शन की वजह से ज्यादा स्टिफ ये मिलता है. एंड वन ऑफ द मोस्ट रीजन, कॉमन रीजन कि जो जहां से वो पियर्स होती है नीडल, वहां के स्ट्रक्चर्स में अगर कोई स्ट्रक्चर ज्यादा डैमेज होता है पर्टिकुलरली, तो वो स्कार टिश्यू डेवलप करता है. फर्स्ट ऑफ ऑल थिंग, वो स्कार टिश्यू डेवलप करता है. सेकंड थिंग क्या होता है कि सी सेक्शन जब होता है तो जो थोरेकोलंबर फेशिया है, जो टोटल फेशिया कवरिंग है हमारा पेल्विक रीजन का, उसको कट करके फिर उसको स्टिच किया जाता है, तो दैट बिकम्स स्टीफ मोर. नॉर्मल डिलीवरी में क्या होता है, वजाइनल डिलीवरी में वजाइना से बेबी आउट हो जाता है और जो फेशिया टाइट हो गया था वो रिलीज हो जाता है, वो एकदम से छूट जाता है और बिकॉज ऑफ मूवमेंट्स वो नॉर्मलाइज हो जाता है. लेकिन सी सेक्शन में क्या होता है ना कि उसको सेक्शन दिया हुआ है, वहां पे स्कार दिया हुआ है, तो वो जो फेशिया है वो ठीक ढंग से वापस रिस्टोर नहीं हो पाता है, तो डिस्टोर्ट हो जाता है. तो बहुत बार वो फेशियल की वजह से भी थोरेकोलंबर फेशिया में पेन होता है. तो इसीलिए पेल्विक फ्लोर स्ट्रेंथनिंग, कोर मसल स्ट्रेंथनिंग, स्पेसिफिकली क्वाड्राटस लंबोरम स्ट्रेंथनिंग जो है वो बहुत जरूरी है. और जैसे कि मैंने कहा कि बहुत बार वो बिकॉज ऑफ दैट पर्टिकुलर स्ट्रेच बहुत ज्यादा प्रेशर उस पर आता है पेल्विक फ्लोर पे, पेल्विक रीजन पे, तो उसकी वजह से भी वात बढ़ जाता है वहां पे. इसके लिए सहचर तेल बस्ती वर्क्स वेरी बेस्ट. ओके फ्रेंड्स, सो इट इज ऑलमोस्ट 5. आप लोगों को भी ओपीडी जाना होगा. एनी मोर क्वेश्चंस और वी शुड वाइंड अप फॉर द डे. थैंक यू दीपिका मैम. ओके फ्रेंड्स, देन सी यू सून. और कोर्स के बारे में, इसके बारे में, यस मैडम, यू कैन डू द अभ्यंग. अभ्यंग विथ षष्टिक्षाली विल मोर हेल्प. थैंक यू डॉक्टर जयवंत. ओके, देन stay safe, stay healthy. See you soon.